Hi everyone, my name is Madison Duncan and my final project relates to robotics and its effect on the healthcare industry. So what did doctors do before robotics? Well, about 3/4 of the procedures done during the Civil War were actually amputations. This is likely because of the fact that surgeons at the time were unskilled and didn't really know a whole lot about medicine. So the unfortunate thing about amputations at this time was even if the patient did survive after the amputation, a lot of times they died because of the risk of infection. So medicine at this time wasn't very effective. So why should we care about robotics in healthcare? Well, if you didn't know, Johns Hopkins in 2018 stated that medical errors were the third leading cause of death, just after heart disease and cancer. So robotics are going to improve the accuracy because they can work in a small amount of space, like millimeters, that the human hand cannot. And this accuracy is also going to lead to patient safety. Also, you should care because you'll likely interact with these robotics in your doctor's office if you already haven't. The first impact of robotics in healthcare I want to talk about is the supply chain impact. This will relate to a lot of our business majors in this class. So robotics are going to replace dangerous and tedious tasks. For example, this is an image of the pharmacist Robotics. Its job is to replace the tedious task of a pharmacist and getting the prescription ready for a patient. So what this is going to allow is for the pharmacist to have social interaction with the patient and tell them how to use the product, advice, how to use the medication, things like that. So this is making a more personal experience, and as you can see in quotations, it's putting the care back in healthcare. Another impact of robotics in healthcare is the impact on cost effectiveness. So robotics are going to replace otherwise dangerous jobs. For instance, maybe moving about 800 pounds of medical material. So this is going to save the company money that would pay to a human in salary. Also, another cost is post-treatment complication costs. So what are these? These are costs that arise from complications after surgery. So let's say you have surgery, you get stitches, you're done, you go home, and then all of a sudden you're having all this bleeding. Well, you're going to have another procedure to go in and have them fix what they messed up initially. This is an additional cost, so this is a post-treatment complication cost. So how are robotics going to cut down on this? They're going to guide treatment choice and make more accurate diagnoses. There is an artificial intelligence end program that looks at patterns of outcomes and symptoms, and it makes a personalized choice for the patient on the best treatment option, the best diagnosis option. So this is going to cut down on the risk of complications afterwards and those complication costs that could arise. So I know I had just mentioned that robotics are going to unfortunately replace some jobs, but the good news is that they're also going to create new healthcare jobs. I have two listed here. The first one is a product manager. This person is basically responsible for being the absolute expert of a medical device, product, or in this instance, the robot. They have to get FDA approval, they have to know all the safety concerns, and they have to be able to instruct anyone in how to use the product properly. So then we have a sales or clinical specialist. Your clinical specialist might be a nurse, and then your sales specialist is going to be a sales rep. But one thing that they're both going to do is they're going to relay information to the doctors. They're going to be present during surgical cases, and they're responsible for telling the doctor how to hold the product, when to use the product, what features to use for different scenarios. They're basically just there to make sure that the doctor is confident in the procedure that they're about to do. Let's talk about surgical robot features and benefits. So the robot that I want to focus on is the Da Vinci robot made by Intuitive. The whole idea here is that we're doing minimally invasive surgery. So this is also exactly what it sounds like. We're going to use a robot to make the smallest incision that is necessary to get the job done in millimeters, something so small that a human hand could not work in. What this is going to accomplish is a lower infection rate because it's a smaller incision, it's less area affected, right? So as well, this is going to result in faster healing, less blood loss, less pain to the patient. And the really cool thing about the Da Vinci robot is that it applies to tons of different things. You can use it for heart, colon, rectum, female reproductive organs, your kidney, bladder, chest, general cases. There's lots of applications, which makes this robot really cool. So here's a photo of the said Da Vinci robot. And it looks really complicated and overwhelming, but as I mentioned earlier, this is why you have a product management team. This is why you have clinical and sales specialists, to be present at the surgery and help the doctor in case there's an emergency. Someone's there that knows the product front and back, like the back of their hand. Another impact of robotics is rehabilitation robotics. So the purpose of these is to help recover lost motor functions that someone lost. Commonly, people probably know like stroke, but accidents, there's other ways people can lose motor function. So these rehabilitation robotics are going to allow patients to continue their therapy sessions at home For potential faster recovery, anyone that's a former athlete that went through physical therapy knows they'll tell you practice makes perfect, just to keep practicing doing the exercises. So if you have that robot at your home in a safe space, there is that potential for faster recovery. All right, so let's go ahead and wrap up on the impact of robotics in the healthcare industry. It's useful for diagnoses, supply chain, minimally invasive surgery, and all those different organs that we talked about. Cost effectiveness, creates new jobs, and it's useful in rehabilitation robotics. It's really exciting to see where all this innovation is going to go in the industry. Thank you so much for listening.